So very, very privileged to be joined today by Dr. Q, who is live on air with us right now. Dr. Q, really fantastic to have you along. Thank you very much for joining us. Welcome to Clicks Live.
Yes, hi there, guys. Thank you so much for having me again, third year around, and I'm still as passionate.
Ah, fantastic. It is really brilliant having you back. I was just saying to you off air, me and you spoke about a year ago around this time with Oral Health Day.
Yes. It was us last year. So I think you said you even remembered me from the last time. I'm still here, guys. I'm still rocking.
Well, let's get straight into it because I've got so many questions, and I also want to talk about the youth, and especially with the little ones. And I want to start there, Dr. Q, if you don't mind. Let's say we have a 7-year-old child, okay, who is already starting to grow adult teeth behind the baby teeth, behind that sort of milk teeth. What would now be the best time to take a child to a dentist?
So I always tell my clients the best time you want to bring your child is the moment that their teeth come out. By the time that the adult teeth are coming out, you find the child has been consuming sweets, has been breastfed, or sleeps with a bottle, and there's pre-existing problems. So you'll find sometimes a parent will come with a patient child, and the child will have swollen gums. And then they're worried about the swollen gums because obviously the adult teeth are also coming out. So in that instance, obviously, I would have to either assess how exfoliated that baby tooth is. Is it ready to come out? Is there no abscess? And then obviously if it's still fine, we want to obviously wait until it's fully time for it to come out. If it has a bit of symptoms, problems with the gums, then we'd obviously opt for an extraction. But you want to bring your child as soon as possible so that, number one, you orientate them onto the chair with the dental chair. You want them to have a healthy relationship with the dental chair. Usually what you find is that they get outsourced information from their peers, from family members, that the dentist is a very terrific person, very horrible person. And it goes into their adulthood. So a person doesn't come for their 6 monthly checkups, doesn't come and maintain their teeth, and then you find they have the oral burden. So the moment that the teeth come out, you must be at the dentist.
Yeah, okay. All right, I just wanted to check because I think a lot of parents, obviously, they will also share whatever anxiety there might be with the little ones, so I think that also was important for me to ask you that. Now, obviously, we hear this a lot. Flossing is important. But now, when sometimes when you floss, your gums might bleed. So a lot of people, the rumor has it, that have stopped doing so. Why is it still important then to floss every day?
So with flossing, we need to apply the principle of toothbrushing as well. So with toothbrushing, it's mostly removing about 60% of the oral debris in the mouth. The remaining 40 stays in between those hard-to-reach areas, which a toothbrush bristle can't necessarily go in and reach. So what happens over time is plaque accumulates in those in-between areas. It's like when I use an analogy of when you sweep a dirty place, and then there's those corners where a broom is not going to go, but a feather duster is. So if you don't go in those areas for over, a period of time, the gum gets irritated, it gets inflamed, and then it starts bleeding. So the reason why sometimes when you are flossing for the first time, your gums are actually shocked that, wow, this person's actually flossing. So it reacts with bleeding and a bit of tenderness. But over time you find, because you are doing it on a regular basis, you are removing the plaque on a regular basis, the gums get used to that feeling and stop bleeding. So it's imperative to floss. You cannot go without flossing, even if you're not using the string floss. There's always alternatives. There's the interdental brush, because I know with other patients, they say they have tight contact between the two teeth. So sometimes they feel like the string gets stuck. So there's always options of an interdental brush, or if you feel the interdental brush is a bit too harsh, then you can always use a water flosser. But you must be flossing.
Yeah, and then of course, so with those three different flossing options, it is really to what is convenient to you.
Yes, the world is your oyster.
Let's ask you this. Let's say you've got a black hole in on the back end of your tooth, which obviously not visible to public, but you're pretty much very well aware of it when you play with your tongue, and you want to visit the dentist, but there's obviously the fear that the tooth might be removed.
So your black hole is obviously usually indicating a decay occurring in that tooth, and it's something that's going to progress over time. So it's not only an extraction that we obviously do for black holes. Black holes can start very little, the early lesions, where we can actually save it before having to resort to an extraction. So sometimes you find you can just be coming in for an easy filling. Sometimes if it's extended and we don't have too much tooth destruction, then we opt for a root canal treatment. So the extraction really is the last resort that we go to when we see, okay, the prognosis here is moderate to poor. Trying to fill this tooth up might actually be redundant, so rather just extract. Only in that instance. And you find if you wait for that black hole to become worse and worse over time, the extraction is the only option that you do have when you get to the dentist, because now you're in pain, you have a dental abscess, you waited until the tooth broke down too much to save, and we have to extract. So better to come earlier than later.
Yeah. With us on the line this afternoon, Dr. Njotini. It is World Oral Health Day, which is on the 20th of March, just around the corner. And of course, where the world unite and help to reduce the burden of oral diseases, which affect everybody, as well as health systems and economies everywhere, which is very, very important to note. And once again, it is really brilliant having you with us. I've got a question for you from a listener that has just popped in, and I want to ask you this as well. And thank you very much to the listener for sending this through. The question is, why am I having severe multiple teeth pain and headaches after having a dental clean 1 week 4 days ago? And how long is it supposed to last? So severe teeth pain, maybe sensitivity around that as well, and it's linked to some headaches. Okay.
So, with the deep cleaning, we go in obviously with our piezo scaler. It's a ultrasonic scaler, and it basically vibrates around the tooth, under the gums. So you find when after the cleaning has occurred, your gums are, especially if you had come in where your gums were quite inflamed, your gums are a bit more sensitive with the days going, past that appointment. But after a week or so, you'll find it's going down. It's the same principle I think I applied with the flossing.
Okay.
Your gums are obviously, they receive that initial shock, especially if you have severe gingivitis or let's say periodontitis where your gums are really inflamed. It takes a long time now for it to recover, and obviously after, if you come every 6 months, then you get used to it. So it could be that, but it also could be that the person might have a sensitivity problem. Let's say maybe they're also brushing hard at home, or they are sort of, consuming a lot of acidic foods, acidic drinks, which break down the protective layer, which we call enamel. So that helps us with our sort of protection from cold and hot stimuli, so cold and hot drinks. So once you lose that layer or teeth shedding, you start becoming quite sensitive to all of these things, especially after the cleaning, right? Or lastly, it could also be that the gums are going down. So it's a condition that's obviously been progressing over time where the gum is receding. And we know with the crown, there's the enamel layer, but once you get to the root surface doesn't necessarily have the protective layer. It has sort of a second layer which has pores, and of which these pores go into the nerve supply, which makes it hypersensitive after being touched. So it could be all three. I would say to that listener, if let's say after 7 to 14 days you're still feeling the sensitivity, go back to your dentist.
Okay, so let's call it a 2 week gap, which is basically 3 more days to go, if they can bear. if they can bear it, and it could be that. On your response there to the listener, and also once again, thank you very much to the listener for putting this question through. You said like the gums will go down or sort of retract. Is there a way for that to be reversed?
Yes, there is. You get your gingerplasty surgery. So there's a special person called a periodontist who specializes with everything that has to do with the periodontal health.
Okay.
So periodontal health is referring to the ligaments, the gum attached, and the bone around the tooth. So once those are in trouble, that's your guy. So you refer either to a periodontist. Sometimes these things can be a bit expensive, so sometimes we only have one option, which is to pull out that tooth that has the gum recession. But obviously, if it's general, you want to obviously intervene. But also, you do get your desensitizing toothpaste. You get your Almex, you get your Sensodyne, you get your other lines that cater specifically for sensitivity problems. So they should definitely go on to Sensodyne Pro Enamel or Repair Protect. Use it twice a day for no less than 2 minutes, and then see if there's a difference in the desensitization.
No, thank you, Doctor, for that. And once again, thank you very much to the listener for sending that through. Our topic today, obtaining optimal oral health. And we're joined on the line by Dr. Njotini as World Oral Health Day is happening on the 20th of this month, which is just around the corner. Now, let's talk quickly because we've been touching on it, on checkups and dental cleaning. But what should one expect at a 6-monthly checkup and dental cleaning?
So, if it is your first visit, obviously we have to take the necessary imaging. Initially I create a rapport with my patients. I talk a little bit. We talk about medical history. We talk about dental history. How many times have you come to the dentist? How many times are you brushing? So we get a consensus of where you are in terms of your oral health status, right? That'll be the primary stage. And then obviously we move on to the stage where I need to check what's in the mouth, what could be happening in the mouth. If you have a main complaint, I address that first and then obviously scan the rest of the mouth. And then obviously I ask for you to bite to see if there's something up with your bite. I check for wear facets. So I look at it clinically, what we're currently looking at, and then I take x-rays to see what is happening underneath there where we can't see, obviously, with the naked eye. Then obviously that is when we see if there's any interproximal lesions, your cavities and whatever. Then obviously we address that. If not, if no cavities are present or we don't have any gum problems, then we go ahead and we do a cleaning and obviously a polish. And we talk about how we're going to maintain it and see each other after every 6 months. So that's the basic dental consultation and cleaning.
Yeah. Now, I've heard this rumor. I don't know how true it is, but since we're talking about this, I heard that frequent snacking, savory snacks included as well, can still cause cavities, but despite not consuming any sweets or very little. Is there any truth in that?
So you have to consider two factors. One being that sugar, sucrose, is not the only thing that breaks down. You have carbohydrates. So your starch, your maize meal, your acidic drinks, your coffee, your Coke, they all break down into a small substance that interacts with the bacteria in the mouth. And once it interacts with that bacteria, it creates an acid. Right? Are you still with me? So that acid breaks down the tooth, and it's what we call demineralization. So what happens is the mouth sort of tries to defend itself by creating a buffer, sort of to raise the pH. So imagine now the acid in the mouth is obviously lowering the pH, making it optimal for destruction to happen, right? So the saliva comes in and sort of tries to act as a buffer. But when you are frequently snacking, you don't give your mouth enough time to recover, number one. But number two, obviously going back to the fact that carbohydrates are also prone to breaking down and creating these acids with the bacteria and causing demineralization. So a person could be eating a savory snack, let's say nuts, and is under the impression that I'm still fine because I'm not eating sweets, I'm not going to get cavities. No, you can still get cavities, especially if you are frequently snacking. Yeah. So it's basically sort of a line that works that way, in that if you eat, you need to wait at least another 45 minutes before you snack. If you are drinking your coffee, don't drink your coffee at a slow pace. Rather, drink it in that one go, because every time you stop, the mouth is trying to recover, and then you drink again, and then the acid, starts to build up again.
Oh, wow.
Yeah.
Yeah. Oh, that's a great tip.
Yeah, one way of looking at it.
Yeah. So, with that being said, in your opinion, doctor, what is the optimal oral routine for daily use? What is there that we should be doing morning to night, 7 days a week?
Look, I don't want to ever advocate for something too elaborate, because sometimes, when something is too much, you feel overwhelmed and then you don't stick to it. I would say the basics are twice a day, in the morning and at night, you brush for your recommended 2 minutes. So spend time in that brushing. Don't just rush brushing in the shower. And make sure that you are flossing at night. And also, I do always advocate, if you want to increase the contact time that your toothpaste is on, rather not rinse with the water immediately. Wait a good 30, 45 minutes just so the fluoride has enough contact time to actually work on the tooth and actually, help it to remineralize, and then rinse after 45 minutes. Or sometimes, some of my patients don't rinse and it doesn't irritate their gums. So brushing twice a day, brushing for the recommended 2 minutes. It's the longer that you brush, not the harder that you brush. Changing your toothpaste every 6 months and flossing.
Now let me ask you this.
For your 6 monthlies, yes, sorry.
Yeah. No problem, doctor. I want to ask you this. If a person now suffers from bad breath, and even after using, let's say, a mouthwash, it somehow seems to be getting a little bit worse. What can this person do in order to alleviate the bad odor, or just get rid of it completely, of course?
So, you find with some mouthwashes, they have a high alcohol content. And what happens is it clears the whole oral microbiome. When I say it clears the field, I mean in that you have good and bad bacteria. Everyone knows this, right? Everywhere that there's a sort of a moist environment, you have good and bad bacteria. So what happens is, in that attempt of you trying to, destroy the bad bacteria, you also clear the field for good bacteria. And what happens is that the mouth becomes dehydrated, number one, because of the alcohol content, but also there's no good bacteria to sort of defend you. So what happens is that an overgrowth of bad bacteria starts to multiply. And you find your odor is actually getting worse because you're not understanding, because you're using this mouthwash and you're using it quite frequently, but sometimes you are causing more harm than good. So it's very important for one to actually look at the ingredients when they're purchasing a mouthwash. Sometimes it's better to get an alcohol-free mouthwash. Or sometimes you just need to go to the dentist. Maybe you have a cavity. Sometimes cavities cause odors. Or you might have acid reflux problem. You could be having, an intestinal problem that's sort of manifesting itself inside the mouth. So there could be different sources, and by you just using that mouthwash, you're just putting a plaster on a very big wound. So rather, try and consult with the dentist. And then if you are going to use mouthwash, make sure you are monitoring what is in that mouthwash.
Yeah. Dr. Njotini, it has been an absolute pleasure to talk to you again. Any final thoughts from your side?
I just want to wish everyone a good World Oral Health Day. Guys, take care of your mouths. It's good to have a nice smile. You have a good sense of confidence, and then obviously you have a good mind. Yeah, so happy World Oral Health Day. See you guys next year. Same time, same place.
Thank you, Dr. Njotini. Thank you once again for your time, and a real privilege talking to you. And thank you very much for joining us here on Clicks Live today.
Thank you guys. I'll see you soon.
Thank you. That was Dr. Njotini joining us. And this oral health interview is proudly brought to you by SADA, the South African Dental Association. And SADA's vision is to be recognized as the trusted leader and voice of oral health care in South Africa. Their mission is to promote the interest and serve the needs of their members, and above all, encourage optimal oral health care for all South Africans. If you want to learn more about the South African Dental Association, please visit their website at www.sada.co.za. All the speakers during this week's Oral Health Awareness interviews are part of the Young Dentist Council Exco, and learn more about the Young Dentist Council by visiting sada.co.za /Young Dentist Council.